Hello beautiful, thank you so much for being here. If you are new, welcome. If you love this info, please subscribe. I'm Cody, the founder of Montarbo Skincare, always here to help you have the most healthy, glowing, and gorgeous skin regardless of your age, concern, or budget. And today I want to talk about adult acne, which is very frustrating for so many of us. I experienced adult acne, and I had acne as a kid and growing up, and most of my acne was from drugs, and that's what a lot of my scars are from. Like, I used to do a lot of drugs when I was young, and I'd pick my face. I was like a total tweaker. It was not cute and not pretty, so it's taken me about 20 years to get things back on track. But if you look really closely without the lights and this tinted moisturizer and powder on, girl, trust me, you too would say, okay, so you would probably think you're doing just fine. So listen, adult acne is very frustrating and very confusing because the same rules apply to adolescent acne, and that is that often we're not quite sure the cause of it. Of course, it could be genetics and can be hormonal. Like, you could have a genetic predisposition to more oil production, or that your skin cell doesn't sheet off quick enough, and when you produce more oil, and that's genetically, and you don't also have the cell that is sheeting off quick enough, like your skin cycle isn't happening quick enough, you have both of those things going on, even more reason, or you have more of a potential of even more breakout and deeper painful breakout, like more cystic acne. But typically adult acne is acne that is acne, and it's being brought on either through stress, through not sleeping, through your hormone changes, through something that may have been more dramatic in your life, including some trauma of a lot of cortisol being released, a lot of fight or flight, a lot of like issues going on in your life can definitely trigger adult acne. It could just be now you're dealing with acne and you got lucky when you were younger and you're kind of late to the game, and now your skin is producing a little bit more oil, but that oil could be stimulated through, like I said before, the lack of stress, the hormones. It could be from medication, it could be from working out, it could be from taking a lot of pills, medications, or steroids, or eating a lot of like nutrient food, vitamin food that has a lot of biotin and things in there that are causing a spike or an elevation of more oil production. And then if you are on birth control now, or you were on birth control or antibiotics, you could have damaged your microbiome, your internal system a little bit, or your hormones with the birth control, and now you're dealing with the issue of adult acne because your system is like it's trying to regulate itself and reach its natural homeostasis, but it could be from the medication or the pills or the hormones or what you were doing before, and it's creating like the perfect storm of why you're breaking out, which seems very confusing and out of left field. So a lot of people will try to go get medicine right away, and even extreme cases like people are very extreme and they want to just do Accutane because Accutane is going to cure. Trust me, we see tons of people that have been on Accutane 2 or 3 times and they're still breaking out. So Accutane is not a cure. There is no cure for acne. But the things that I think you could do that would really benefit you if you're struggling with adult acne, or you're catching it now at the beginning before it gets really bad, is to always be conscious of what you put in your mouth. And I know some doctors would disagree and professionals, and that's totally fine. You do you, I do me, okay? And I say because I know that if you eat a lot of sugar, you can turn on androgen hormones that produce more oil. If you eat a lot of carbs, you can turn on androgen that turns on more oil. You can also mess up your microbiome doing that, a lot of sugar and a lot of inflammation. So it creates the potential for adult acne because the skin wants to detoxify itself, and one way that it does that is through breakout or acne or inflammation. Another thing that could happen is that if you took a lot of antibiotics when you were younger and you were sick a lot, and antibiotics are prescribed so often, so readily, so easily, that a lot of people have messed up their gut microbiome and their gut flora. And when you do that, what happens is now normal things that you eat or do you're more sensitive to, or you are not able to ward off, like your own gut immune system isn't able to fight the fight of that gluten or that over amount of sugar that you ate, and to be able to treat your tummy the right way, because there's just so much inflammation through using so many antibiotics. So now you have like a resistance. So that could be definitely a reason why. Another thing could be that you've just been using a lot of products and it's really not, you're breaking out as an adult because you're using the wrong products, you're using too many products, or you're using them too aggressively. That happens a lot too, because YouTube, although it's so wonderful, you can get in the habit of thinking this girl's acne is like your acne and it's not, or these 5, 15, 500 products are gonna help because it helped her, and it's not, it's gonna ruin your skin. So the rule is always the same, less is more. Ease into products a little bit at a time. Don't get carried away with 9 steps and doing all of these dramatic and drastic measures to help your skin. And the thing that I'll leave you with is that if you're struggling with adult acne now and they're painful and there is no pus coming out of them, then you need to get your hormones checked or go to an endocrinologist or a naturopath or a doctor and figure that out, especially if your cycle is off or it's too heavy or it's too low, or you had birth control before and it didn't help or it did help. You want to get in the habit of figuring out as best as possible the cause of what's happening, not treating the effect. And that a lot of times dermatologists, doctors, our industry, life, we have a habit of just throwing band-aids on the effect, throwing band-aids on the disease, but not the cure, or not the cause of what's happening, or the cause of what was causing that disease. So that's why we always try to come from skincare from a state of health and vitality and getting the cells better and the pore better and giving your skin a lot of nutrients, because healthy skin is less reactive. Healthy skin doesn't usually break out. Healthy skin doesn't usually develop sun damage. So healthy skin is really the goal here, not just treating a little bit of a breakout. And if you're dealing with breakout now and you're just spot treating with benzoyl or retin-A or retinoid or some kind of agent, then you're just going to continue the breakout because you're not treating the whole surface area. Because below the surface of your skin, we all have them. Some are visible, some are not. Some become pustules and blackheads, but a lot of them don't. They just kind of rise up and release, which are microcomedones. And those microcomedones can have the potential to become a pustule in the skin, which is that kind of inflamed pussiness. So if that's happening to you, then and you're just spot treating one, then what's happening is a new microcomedone will just keep popping up like whack-a-mole. So you need to treat all of the face and then put more on as a spot treatment. Otherwise, you're just gonna, for the rest of your life, be spot treating. All right, guys, if you have any questions about today's video, feel free to ask them below. I hope today helped. I just wanted to kind of do a general overview of some clarity of why you might be breaking out and what you can do about it. You can always seek a professional. You can get a facial, you can get a chemical peel. You could, if you resonate with prescription like antibiotic or birth control or something like that, then feel free to go do that if you want. Just know that there is no cure, there is no one solution, there is no one size fits all for everyone, because everyone's skin is different, everyone's baseline is different, and everyone's cause is typically different, even though that the cause of acne is pretty much consistent with more oil production and less sheeting off of the skin layer. It could be brought on by something you're doing, which is unique to you, so it's subjective, so you need to be treated with a level of care and understanding that it's unique to you, instead of kind of a blanket cookie cutter kind of approach of like, here, take these antibiotics, use this retin-A, use this benzoyl peroxide. If that doesn't work, we'll put you on Accutane, because that's not the way that it should be done, because you're just still treating, like I've said before, you're treating disease, you're not treating the cause. All right, guys, I love you. Stay gorgeous. I'll see you soon in a new video. Bye.